We've just had a great day, I guess, discussing some of the challenges those of us as researchers and inventors of digital products are experiencing, and we've brought together NHS stakeholders. We've had industry partners speaking, and we started off with a real highlight with David Lawson talking from the Department of Health and Social Care and telling us a little bit about what's in store in terms of the 10-year plan in some of this area. And I was really excited to hear that the initiatives coming out which to try and centralise some of the difficulties that we're having in terms of procuring products, having a centralised system where people can access evidence-based treatments and so forth. So it really gave us a nice positive spin at the start of the day, but then we talked a lot about some of the challenges we're currently experiencing with often developing really good evidence-based products, but we're not quite getting it into the hands of the patients. So that's been the theme of the day. I think we've started to talk through some solutions, but I think really importantly is we've come to the conclusion the importance of us all working together in this space, both researchers here at King's, but really also we had people coming from all around the country, which was brilliant, so talking about some collaborative links there, but also the importance of us as researchers working with industry, working with the Department of Health and Social Care, working with people with lived experience and come together really to try and make sure that the things that we're developing actually get to people. So thank you very much.
It's been a fantastic day at the BRC Maudsley event. It was really great to have the roster of different talks talking about kind of issues and challenges around adoption and regulation and how we can translate research actually into practice. And the mix with the roundtables was fantastic for hearing everyone's thoughts and opinions and getting a chance to discuss these challenges and the different solutions we're all working on together.
It has been a very thought-provoking and interesting day. What stands out in my mind is discussions around commercialization and partnership with industry. As an academic in the field of clinical psychology, this really does feel like a completely new domain and different language, and that's the highlight for me. Learning that language and the strategies in order to move from innovation to implementation is one of the key goals for me from now on.
And it's been an amazing day we've had to kind of hear about, from different perspectives, innovation in digital interventions, and really thinking from the perspective of people with lived experience, implementation scientists, startups and more established medtech companies, to really think about how we can not only develop good digital interventions for mental health, but also actually how do we get those taken up in clinical practice, or so that the people who we are hoping to benefit can actually have access. And it's been an inspiring day, hearing lots of different perspectives and an enthusiasm to try and solve this so that people can have access to research-driven, effective treatments in routine care.